Hey athletes, what's going on? Branson Brown here, physical therapist and wellness coach with Get Your Fix Physical Therapy, Get Your Fix Nutrition, CrossFit coach at CrossFit Majestic, and I work with CrossFitters and runners to get you from injury to PR in 8 to 12 weeks. We're still on the diagnosis series, finishing off the diagnosis series today actually, still on the knees. Wanted to talk today about arthritis, specifically osteoarthritis. So there's two types, there's rheumatoid and there's osteo. I'm going to specifically talk about the osteo because there's a lot more factors that play into the rheumatoid, and I'm not going to get into that medical side of things. I just want to go based on the performance side of things, activity side of things when it comes to that osteoarthritis diagnosis in the knees. So like I've been saying this entire time, just because you have this diagnosis does not mean it's a death sentence, does not mean you have to stop training completely or forever. First of all, why do we get arthritis? So there's a lot of misconceptions as far as we get arthritis because of all the activities we do, because we run, jump, lift, squat, you name it. Activities get a bad connotation, a bad rep for causing a lot of these knee problems, when in all reality, the opposite is true. There's been a lot of studies done that show runners have better joints than non-runners do. Does this mean everyone who runs or everyone who does sports is not going to have issues? Not at all. But it means that just because you do these activities does not mean it's going to cause a problem. It also does not mean you have to stop these things when you have these diagnoses. It's just a matter of figuring out what you need to do for them. So first of all, why do we get osteoarthritis? What causes this? So basically with this, it's by definition, it's inflammation of the joint. Typically what happens is we start getting some damage onto that cartilage, we start getting rubbing on those joint surfaces over time, that the space in there wears down, we get to this bone-on-bone status. That's worst case scenario. But why does this whole process happen? Majority of these problems is due to, same thing I keep talking about, these mechanical changes. Meaning, other areas aren't moving right. So hips not moving right or ankles not moving right. So that's causing that knee joint to have to move slightly different than what it was intended to move or how it was designed to move. Along with that, weaknesses in the different areas can cause a collapse of that knee, typically to the inside. Once again, causing that joint to move in a way it was not intended to. So anytime our mechanics change, this can cause joint surfaces to rub when they're not supposed to. Over time, the cartilage and surfaces that aren't meant to be in contact with each other frequently start to wear down. So how do we change this? Is it reversible? Technically, it's not reversible, but that doesn't mean things can't improve. What we do a lot of times as therapists and as coaches is we're retraining how to move properly. So, for instance, if you kneel down to get something from a low cabinet, do you stay on your heels and go into a proper squat, or do you get onto your toes? Technically, we should be on our heels in that fold-up squat position. What happens though is because of years of habits that we start to change, then got a text just now. Years of habits that start to change how we move. And so we get into these poor movement patterns. Over time, these poor movement patterns cause these issues to our joints. So as therapists, as coaches, what we do is we retrain these patterns, get you moving properly again by retraining those joints how to move properly, getting everything moving nicely, getting everything nice and strong. It allows you to move well, move properly, move less painfully or potentially pain-free. So that's kind of how the synopsis of how this all works. Arthritis is not a death sentence. It just means there's some inflammation in there, possibly something starting to wear down because these joint surfaces have been touching, rubbing abnormally, improperly. And we just need to correct the movement patterns to take pressure off those areas, restore proper movement, and usually then you are good to go. So If you have questions on this, definitely post any questions or comments on this video. If you have any specific questions for me, want to have a conversation, feel free to reach out to me through Facebook Messenger. I'd be happy to have a conversation with you. So hope you're having an amazing Monday. I'll talk to you later. Bye.